Hi everyone, I'm Leah. I'm a wellness specialist with ACI Specialty Benefits. Today we have with us Dr. Joseph David via Skype. Dr. David is a primary care physician specializing in wellness. He's with us today to answer a few questions on men's preventive health in honor of Men's Health Month. Hi Dr. David, thank you so much for being with us today.
Thank you for having me, Leah.
So our first question for you is, what are the leading health risks adult men should be aware of?
The leading health risks that American men should be aware of today are probably heart disease, which is the #1 killer of men over the age of 45, diabetes, and obesity.
What are the best ways to prevent these diseases?
To prevent these diseases, they're sort of all linked. We'll start with obesity. Prevention of obesity is easier if you start young and maintain your weight, but for most of us, we have found ourselves overweight. 35% of American men are already obese. The key to obesity prevention is simple. You simply have to burn more calories than you eat. The other is exercise. There is simply no way you are going to lose weight if you don't have muscle mass. Fat isn't burned by any of our organs. It's not burned by other fat cells. It's only burned by muscle. Recommendations are 150 minutes a week or 30 minutes a day of a moderate exercise. The last is reduction of carbohydrates. A lot of people focus on low calorie and those. I like to tell people to just try and decrease their carbohydrates, their breads and their sugars and their wheats. The next would be diabetes. This is simply exercise. Studies looking at prevention of diabetes have found that the 150 minutes a week reduces your risk of diabetes by 70%. And the last is heart disease. This is the leading cause of death of men and actually is a complication of obesity and diabetes. First thing you need to do is look at cholesterol control. The Americans should know their cholesterol numbers. Under the age of 40, you probably should have it checked about every 5 years. After the age of 40, you probably should be getting it much more frequently depending on your cardiovascular risk. Your cardiovascular risk is going to be determined by your biometrics. The key ones you need to know: what's your body mass index, which is is calculated off of your weight and your height, your cholesterol numbers, your blood pressure, and your waist size.
That's great information. Thank you so much for being with us today, Dr. David, and answering our questions on men's health and preventive measures.
You're welcome, Leah. It's my pleasure.
And thank you for tuning in to learn what you can do to prevent disease and assure a long, healthy life. If you have any questions or comments, feel free to leave them below, and don't forget to follow us on social media.